I had heard of postpartum depression, but I had never heard of postpartum anxiety. Pretty immediately after the birth, I felt just not right.
I really thought it was hormones. I didn't know anything about perinatal mood disorders. I looked in the mirror and I just did not recognize myself.
I was experiencing feeling overwhelmed and tired all the time, hopeless.
I was having a hard time bonding with our daughter.
I didn't know that much about anxiety and depression after birth. I heard about it. She was suffering alone.
It made it difficult for me to care for our baby, and that came with an immense amount of guilt.
When you have a child, all of a sudden it's like you've lost, your old life, and things change.
So yeah, for a while there was just a lot of anger and frustration of just trying to find that support.
I was mentally in this fog that I couldn't get out of. I was feeling very disconnected from my baby. I had a lot of shame. I felt embarrassed.
Not wanting to leave the house because of fear of something happening outside with the baby.
I would be constantly checking the baby monitor to make sure to, see if he was still breathing. So that's when I really realized, okay, well, this is not just normal new mom worries about the baby. This is something else, and I need some more help.
Postpartum mental illness is a really broad term that we use to look at mental health struggles that may occur after the birth of the baby. And I lean more towards the concept of perinatal mood disorders, because that's a little bit more of a broad umbrella term. Perinatal mood disorders can include any disorders that occur at any time during or after the pregnancy within the first year.
The loneliness started first just physically, because after you give birth, there are so many people there in the beginning, but slowly people stop coming.
You get all that attention, and then all of a sudden you have this child, this life-changing event, and all the attention is now directed at the child.
With respect to vulnerability to depression and anxiety during the postpartum period, it's not only new mothers who can have struggles in those areas, but new fathers as well.
So it can happen to men too, which I didn't expect. I was really it happens mostly to the mothers, but fathers are also susceptible to the same struggles, I think.
And those who appear to be most vulnerable are those new parents who have had struggles with anxiety or depression earlier in their life. All too often, new mothers are told that having a baby is, or at least should be, the happiest time in their life. And that's certainly true. But I think we have to recognize that it can be both the happiest and most gratifying time in their life, but at the very same time also the most challenging and demanding and anxiety and stress producing.
I developed postpartum depression after my second daughter. I was experiencing a lot of anger and frustration with my husband, with my oldest daughter.
I just had racing thoughts, racing heart, could not sleep, could not relax or trust, that things were going well with my son.
We don't experience perinatal mental health issues because we're not good people or because we're not good parents. That's not why those things happen. Perinatal mental health issues are a combination of a constellation of factors, including things like our genetic predisposition, our reaction to hormonal changes, our psychosocial and interpersonal stressors, our level of support, even things like our cultural messages that we were given, both from society about the stigma and also from our families.
The shame was really brought about because I felt like people were gonna think that I couldn't do it, or that I wasn't gonna be a good mom, that I had taken on more than I should have, which a mom should never feel that way.
You have a problem, you handle it. I still felt like this was normal. This was what motherhood is. This is what parenthood is. This is how I'm gonna be feeling.
I felt so strange and not right that I reached out to my midwife and got some tests ruling out some medical stuff, and was still stuck with feeling like that, and she had suggested that it could be postpartum hormones, postpartum anxiety and insomnia. And I don't think I wanted to accept that because it didn't have a quick fix, I guess. But she hooked me up with an emergency psychiatrist, someone that had committed to see women within 5 days of being called.
I remember finally being brave and telling Flores what I was feeling, but it was really hard, I remember, for you to understand.
Yeah, it was hard for me to understand, and I remember like I just wanted to fix it right away. Like, what can I do? I'm gonna fix it. I'm gonna take care of it. And I had to step away from trying to fix it and just be there to support her and listen to her, and not trying to like get answers.
I was afraid to even talk to my partner about it because I knew what like postpartum psychosis was, and I'm like, I don't want him to think that I'm gonna hurt my baby. I don't want anybody to think that I'm gonna hurt my baby.
Kind of at its core, we always have a fear that somebody's gonna validate that maybe we really are off the rails. But one thing to think about is when we reach out for help, what we're really saying and modeling for our spouse, for our children, for our partner is, when you need help, the best thing that you can do is take the courageous step to ask for it so that you can take better care of yourself.
When my son was first born, I just had this idea that like a good mom doesn't take medication while she's breastfeeding, and I really wanted to breastfeed. You know, I was seeing this therapist, I had a psychiatrist, and I was taking some medication during that time, but I had this desire to stop taking it. And so when my son was around 5 months old, I weaned off of that medication, and that's when stuff really hit the fan.
It's important to have a careful evaluation of what your symptoms are, what role, if any, medicines might play in helping alleviate those symptoms and helping you to recover, but also then getting advice on the safety profile of those medicines in breastfeeding. So taking medication to treat postpartum depression or anxiety is not necessarily going to lead you to have to stop breastfeeding if it's important to you to be able to continue that.
I started on a Facebook group. I found like a group for moms, and I joined it, and that helped me a lot.
I attended a support group weekly. Nothing earth-shattering, but just listening to women who were in a darker place a few months ago and now we're seeing some light and some relief. That was a huge help.
Many, many other women have gone through this, and people should just be talking about it a lot more.
Asking for support when you're wondering if you're struggling with a perinatal mental health issue requires a lot of intentionality and a lot of courage. But the fact that you are asking for help is actually a signal of strength. It's a signal of your resilience. The research shows us that when we think about anxiety and depression, the best treatment is actually a combination of medicine and therapy. So thinking about finding a good perinatal trained therapist is also a really good step.
Our story took us years to heal from that experience. One of the things that felt really scary was to have another baby. I was really scared about what it would look like if this happened again. I had a lot of PTSD, but 7.5 years later, we got pregnant again, and we now have a little baby boy.
I was brave enough to have another baby. And Santiago came.
It can seem really dark, but just know it's not permanent, and you will get the help that you need.
You don't hear a lot of stories about women that experience this, and that's why I want to share my story with as many people as possible, because you shouldn't feel so alone and you shouldn't feel so ashamed of having these feelings.
There's no shame in seeking out that help, and that it can be better. You don't have to just suffer with it, because it's not a mother's duty to suffer.
I would want women to know that you can be in the darkest place that you can imagine, and like the bottom. You can think that you'll never come out of it. You can't imagine that you will, but women have been there. I was there, and you do. You can recover not just enough, but fully.